Introducing 새움메디텍's new technology, Epi-Detection, which is safer, more accurate, and shortened procedure time compared to traditional loss of resistance technique. Chapter 1. Functions. Epi-Detection is a medical device that detects negative pressure in epidural space. Epi-Detection precisely identifies the epidural space to help the anesthesia process proceed safely. Prevent complication. Epidural hematoma, postdural puncture headache, spinal cord injury, temporary loss of consciousness, limb paralysis. Epi-Detection is the best pain management solution. Chapter 2. Correct usage. Identify the area for the procedure. Connect the syringe to the epi and pull out the piston to check if the LED light on the product changes. Then press the power button to reset. Insert epidural needle down to the ligamenta flava. Remove the inner stylet from the epidural needle. Connect the epi to the epidural needle. Press the epi power button and the green LED will light up. When the epidural needle enters the epidural space, the LED on the epi turns blue. Open the lure lock and insert medicine or catheter. Chapter 3. Precautions. Do not connect epi to the needle in advance. Do not connect when epi power is on. If the needle is inserted into the human body without the inner stylet, foreign material will make its way inside the needle and pressure cannot be checked. Do not open the lure lock before reaching the epidural space. Do not pull the needle and epi out during positioning. When removing the product, the LED light turns blue due to a change in pressure. If failure occurs, remove the needle and epi completely from the patient's body. Reset the product by pressing the power button on the epi. Knowledge archive accumulated through numerous studies and tests. Epi-Detection, developed based on detecting negative pressure, will lead to greater patient safety and satisfaction of medical staff. 새움메디텍.